Dr. Pankaj Deshpande is a consultant pediatric nephrologist with the Hinduja, MGM and Bethany hospitals in Mumbai. After completing his MD in pediatrics and 2 years of experience in pediatric nephrology in Mumbai, he went to United Kingdom in 1996. After working at institutions like the Birmingham Children's Hospital and Guy's Hospital in London, he was a consultant pediatric nephrologist at Southampton General Hospital from 2001 to 2005 before returning and settling in Mumbai. He has a vast experience in pediatric nephrology, including pediatric dialysis and transplantation. Thank you for coming here, Doctor.
Hello.
Doctor, we've heard about adults getting kidney problems like urinary tract infections, kidney stones, and all that. But do children get kidney problems as well?
Thank you for asking me that, because that is one of the questions that most often springs up when I mention that I'm a pediatric nephrologist, meaning that I look only after children with kidney problems. Now, what we need to understand, the short answer is yes, children do get kidney problems. But just to elaborate on that, we have adults who get kidney problems secondary to diabetes, myocardial infarctions, and heart attacks, and that kind of stuff. But in children, when we talk of children, we need to understand that we have got about 2 to 3 lakh patients who start dialysis program every year in India. Now, a majority of young adults in the age group of 15 to 30 in this category will have the origins of their kidney illnesses in childhood, which unfortunately has been missed because it's completely asymptomatic and nobody's bothered to look at these children who are eventually going to develop kidney failure. So I didn't say it. Shakespeare said that the child is the father of man, and unfortunately it holds true even in pediatric nephrology. So apart from this major chunk, we also got other major problems that come up in children, which include urinary infections, wetting, nephrotic syndrome, as we'll discuss later on.
Doctor, how would kidney-related matters in children be different from adults?
That's again a very good question, because children are not miniature adults, and I think we need to understand that. Apart from the spectrum of illnesses being entirely different in children as compared to adults, where the reasons for kidney failure are completely different, there are various other things that are completely different in children as well. And these include a very simple thing like investigations. For example, let's take an example of serum creatinine. Now, creatinine is the blood test that is used to determine what your kidney function is. If you look at labs all over the country, the normal range for this creatinine is given as 0.6 to 1.2 milligram percent, which unfortunately is completely wrong for children. And all over, parents as well as doctors will use the same range to determine whether the kidneys are working well in children. So a creatinine of 0.8 milligram percent, which may be completely normal for an adult, is actually very high for a child, because the creatinine is a protein that is produced by the muscles and is thrown out by the kidneys. So higher your muscle bulk, more will be your serum creatinine. Lower your muscle bulk, lower should be the serum creatinine. So children will have a lower serum creatinine. So if you don't adjust for this, you're going to miss out on all these children who are going to land up with kidney failure and dialysis later on. The second part in children is a very important aspect of growth. Children are still growing as compared to adults, where they have finished their growth. And this part has to be looked at very carefully. So nutrition in children assumes great importance. As to use of medications, you need to change the medications according to the particular child so that you allow the child to grow to his potential. Again, a common example is nephrotic syndrome, where we tend to use steroids. Now in adults, you use daily steroids. We don't use daily steroids in children because we want them to grow, and therefore alternate day steroids is what would be used. So kidney illnesses and kidney problems in children are much different and have to be tackled in a different manner as compared to adults.
It's very important that parents take it more seriously and probably consult not just a pediatrician but a pediatric nephrologist or urologist.
I think the main aim is to educate the pediatricians so that they pick up and then they can refer to a pediatric nephrologist.
Doctor, can kidney problems cause poor growth in children, and how does one know that they're causing?
Right. Now the kidneys, as I mentioned earlier, have two main functions. One is to eliminate the waste products, And if that function is affected, you call the child as having kidney failure. Now that function, if it is affected in the long term, is called as chronic renal failure or irreversible renal failure. And you can get poor growth associated with that, but that comes up pretty late when your kidney function has dropped to less than 50 to 30%. The second part of the kidney function is to actually preserve all the good stuff in the body. And if this function is affected, then the kidneys unfortunately will leak out all the good stuff that is supposed to be retained back in the body, and therefore they tend to have very poor growth. Now these are called as tubular disorders, and there are conditions like renal tubular acidosis or Bartter syndrome which cause very, very poor growth in these children. The way you pick up these children is actually very difficult because there are many causes of poor growth in children, but these children often tend to have an excessive urine output. You will find that they are excessively thirsty, therefore they are crying for water all the time, and they will hardly ever eat food. They'll be extremely irritable. There'll be conditions like rickets, which does not get better even after giving vitamin D. So these are a few indicators that the child may actually have a tubular problem that needs to be looked at. It's very easy for me to say this, but it's very difficult for parents to decide what is excessive urine output, because the child passes urine and the parents think the child is passing urine well. So unless you've got an earlier child to compare as to how much urine this child is passing, it's actually a very difficult thing for the parents to pick up.
Thank you for coming in, doctor, and sharing your knowledge with us.
It's a pleasure coming here. Thank you.
For more such information related to your health, log on to health.india.com.